Hello, my name is Lindsay Sutherland. I'm a Senior Advanced Neonatal Nurse Practitioner in the University Hospitals Dorset in Poole Hospital. And this is my presentation for Is Antenatal Exposure to Selective Serotonin Reuptake Inhibitors Associated with a Prolonged QT Interval in Term Neonates that is 37 weeks gestation or greater when it's assessed on an electrocardiogram at 48 to 72 hours of age. So depressive symptoms affect 10 to 20% of pregnant women worldwide. Treatment for this can include antidepressants such as selective serotonin reuptake inhibitors or SSRIs. However, SSRIs in pregnancy can increase the risk of prematurity, neonatal abnormalities such as persistent pulmonary hypertension of the newborn, congenital defects, and withdrawal symptoms. SSRIs are also known to prolong the QT interval in the electrocardiogram or the ECG of adults, which can lead to sudden death, but limited data is available for neonates. So this prospective case-controlled study looked to see if there was an association between antenatal exposure to SSRIs and a prolonged QT interval on the ECG of term babies at 48 to 78 hours old. Ethics Committee permission was gained in December 2016, with the trial starting in February 2017 and concluding in February 2019, which included a 6-month follow-up period. A group of neonates who were exposed to SSRIs in utero received an ECG at 48 to 72 hours old, and these were the case group. And they were compared with healthy neonates whose mothers did not take SSRIs in pregnancy but were still in hospital at 48 to 72 hours old. This was the control group. So the control group was made up of babies that had red flags for suspected sepsis and were started on antibiotics, but were later found to be well. The choice of the characteristics for the study group participants was guided by the research question and the need for a proxy control group who would be available to have an ECG at 48 to 72 hours old, and also where there was no indication of a high risk for a prolonged QT interval. Unfortunately, no other group of clinically well neonates were available to provide the required comparison group. Statistical analysis showed that we needed a sample size of 121 mother and baby dyads for the trial. So the trial process, there was an initial screening to see if the babies had been exposed to antidepressants or required antibiotics, and then they were further screened to see if there was exposure to SSRIs antenatally, and if it was they could be part of the case group for the SSRIs. There was an invitation to participate at 12 hours of age. For the control group, the babies were found to be clinically well after some blood work, and therefore they were invited to participate at that point. There was a further screening at 48 to 72 hours old just to make sure they still met the exclusion criteria and were clinically well, and at that point there was a consent was taken, a data collection sheet was compiled which included some demographics, and an ECG was undertaken, and then there were following pathways depending on what kind of outcome for the ECG. So the recruitment to the study, there were 6,620 women who were had live births within that trial period. 179 women and neonates were considered for the case group, and 390 pairs were considered for the control group. However, once they were mapped against the study criteria, for the case group, babies were excluded if the mum had taken other antidepressants that weren't SSRIs, if they weren't term, if there was cardiac history in the medical history of the baby or the mum, if the baby was unwell, if there was any history of alcohol or drugs because of its implications on the cardiac system. This was a self-funded trial, so there was no budget for translation services, so they had to be able to understand and consent in English, and the Ethics Committee required the woman to be over 18. So having mapped that against the babies we had, that meant 115 babies were eligible for the case group, and 335 were eligible at that point for the control group. However, at the point we went to recruit, there were further concerns. So the Ethics Committee required that the women had 24 hours minimum to consider the trial, that We also had to have staff that were specifically trained to take consent available, and sometimes they weren't. Sometimes the babies were unwell at the point we assessed them for the trial. Obviously, the women declined participation. So, and for the control group, the babies proved to be requiring treatment for antibiotics, and that was our biggest group that were excluded. So in the end, 46 babies were recruited to both groups, with 43 of the case group having an ECG and 45 of the control group having an ECG. So of the 43 neonates and 45 control neonates who had an ECG, all had a normal QT interval when screened at 48 to 72 hours of age. Most of the women who used antenatal SRIs were being treated for depression and or anxiety, with sertraline being the most used SSRI. There was no association found between antenatal exposure to SSRIs and a prolonged QT interval in term neonates when assessed at 48 to 72 hours old. However, the study was underpowered and the results must be interpreted with caution. There was further data analysis done to see, although the QT intervals were all within normal range, but to see if any of the variables may have impacted that. And it was found that maternal smoking and alcohol increased in pregnancy, increased the QT interval very slightly. Males had a very slightly shorter QT interval than females, and a lower birth weight gave you a slightly shorter QT interval as well. So based on these findings, there is no justification to implement an ECG screening programme as part of postnatal care for neonates who are antenatally exposed to SSRIs. However, further research could be considered, but based on this study's feasibility, it would not seem warranted within the current fiscal climate and worldwide health crisis. So these are just some of my references. Thank you for listening, and if you've got any other questions or comments, please feel free to email me directly. Thank you.